Severe belly pain in a child. Now that's a moment that makes any pediatrician sit up and pay attention. I know as doctors, the pressure is real. You're not just looking at a child in distress, but at anxious parents waiting for answers. So let's break down what really matters when a child walks in with severe lower abdominal pain, fever or not. First, history is your best friend. Ask the right questions. How did the pain start? Sudden or gradual? Localized or diffuse? Is it sharp, crampy, or constant? And don't forget about associated symptoms: vomiting, diarrhea, constipation, or any urinary complaints. Remember, always check for fever, but don't let its absence fool you. A lack of fever doesn't mean things aren't serious. Now let's talk about the important causes. For boys and girls, appendicitis is always high on the list. Think periumbilical pain shifting to the right lower quadrant, with tenderness and guarding. A fever often shows up, but not always, especially early on. There might be some vomiting too, but don't stop there. In young girls, ovarian torsion or ruptured ovarian cysts can mimic appendicitis and would present with very severe sharp lower left or right-sided abdominal pain. Never forget to ask about menstrual history, even in pre-teens and mid-cycle. Mittelschmerz can cause severe abdominal pain. For infants and toddlers, intussusception is a key player. Look for severe intermittent pain, drawing up of legs, and sometimes red currant jelly stools. These kids might not have a fever at first, but things can turn quickly. And what about urinary tract infections? They can cause lower abdominal pain, with or without fever, especially in younger kids who can't localize pain well. Always check for dysuria, frequency, or suprapubic tenderness. Constipation is another common cause, which can paradoxically present with overflow diarrhea, but always rule out the bad stuff first. Also, let's not forget surgical emergencies. Any green-colored vomiting with abdominal pain means there is a surgical cause. Then, testicular torsion in boys presents with lower abdominal pain that sometimes radiates from the groin. Always check the scrotum. Time is testicle. So, what's the workup? Start with vital signs. Look for tachycardia, hypertension, or signs of shock. Do a focused and gentle abdominal exam. Labs, FBC, CRP, LFTs, amylase, urinalysis, and pregnancy test in adolescent girls. About imaging, start with ultrasound. It's safe and tells you a lot. Bottom line, severe lower abdominal pain in children deserves respect. Be systematic. Keep your differentials broad and always have a low threshold for surgical consults or imaging. And finally, trust your gut. If a child looks sick, don't delay. Early recognition and referral can save lives. Thanks for caring for our kids and always staying curious. Stay sharp and keep making a difference, one little belly at a time.